Well, one of the things that everyone should be very much aware of is that while COVID and the infectious disease pandemic has been grabbing the public health headlines for the last 4 years, the opioid crisis has not gone away. In fact, it's gotten much worse.
Opioid addiction is still a big issue in the community.
Since COVID of 2020, there's been over 50% increase in overdose deaths. We are now over 85,000 deaths per year due to opioids, whether that is a combination of fentanyl, heroin, and prescription. All are causing a terrible trauma, and it's everywhere in this country.
Wellstone and partners are helping educate the community on the crisis. Dr. Chris Johnson shares while there are many cases, certain groups have been affected more.
Specifically in certain populations, non-Hispanic white, typically middle-aged, 40s to 50s, without a 4-year college degree, have been disproportionately affected by this crisis.
And prevention is possible.
Best you can reduce the opioid exposure to patients. Now, not everyone who becomes exposed to opioids develops addiction, but we do know that with increasing numbers of prescriptions, increasing opioid exposure for a longer period of time, that risk goes up. From a prevention standpoint, from a social level, we need to understand the risk factors that would make someone vulnerable to intoxicants, things that would cause emotional distress. If they're worried about where they're going to get rent money and food money. These are social things we can do to help stabilize the situation so people feel more secure, more connected.
And the stigma of addiction should not be a factor for seeking help.
The same way that diabetes is a long-term medical issue, or epilepsy. Addiction is a medical problem. There is treatment, and with treatment comes better lives, better outcomes for people.
For Fox 54 News, I'm Kim McCoy.